Okay, now we're going to show you how we want to demonstrate to taking a maxillary impression. The impression can be used for appliances, study models, or any other thing in orthodontics. One of the things we want to do first is take a tray and make sure that it fits the mouth before we put any wax on it or fill it up with impression material. We've got Aaron here, our young handsome volunteer, and what we're going to do is we've got a tray right here. I'm going to try it in his mouth. I'm going to stretch the mouth out on one side. I've kind of almost got him in a headlock. Okay, and then you want to put the tray in, stretch the cheek out, and then raise the lips just a little bit. Get the lips over the tray. Now then, when you've got it in there, you want to make sure you've got a little play in that tray. So then you know you're going to have enough room for the alginate material. Okay. Open up, Aaron. Thank you. Now we're going to take it out, and now what we're going to do is dry it off, and we're going to put some wax around it. Since we want a good vestibular on the impression material, what we're going to do is put some wax around the tray to kind of hold that wire in. It also makes it more comfortable for the patient. And as you can see, I'm just taking some wax rope, putting it around the edge of that tray. Putting it in all the way around, getting back to the center, and just take your excess off. Now that's going to hold that impression material in there and also give you a nice border mold on your impression of the tissue up in the buccal area. Okay, we have the impression material loaded. We want to kind of bring it up to the front so we don't choke him too much. Make sure that it's fully loaded. We're going to put him in again in the headlock, put it in, make sure you got all the tissue, and then push it up in the back with your fingers. So it's fully up in there and you're going to get all the tissue that you need for your impression. Just hold it in place while it's setting up. And remember, even though your tray has a handle on it, that's not really necessary to use that handle to insert the impression material in the tray. It's just kind of a convenience there. Make sure you hold it up on the teeth while it's setting up. Aaron's doing real good here. Just about done. Okay, now we're going to pull it out, just kind of release it from the back. Pull it out. Okay, now you can see where we've got a nice mold up around the tissue. So we got a nice palatal surface without any bubbles in it, and you can see a good outline of the teeth. That's what I would call a good impression, and I think the lab would like that for any appliance that they're making. Okay, now we're going to take a mandibular impression. Again, when I fit the tray, I have the patient lean their head back, tell them that I'm going to try the tray in. I want to make sure and push the cheek out, and then with my finger stretch out the lips, make sure that it's in there, have him lift up his tongue. And knowing that I've got enough room for my impression material, then I'm going to take it out and I'm going to dry it off, and then I'm going to put wax on it again. As you can see, now we have the wax around the outside of the tray to get a better mold of the vestibular tissue. Now we'll have the tray loaded and get the impression. Okay, we have the tray fully loaded now. We want to make sure that we've got it around the edges. Now we're going to go ahead and insert it in his mouth, open up nice and wide. We're going to put it in. Make sure I can get it seated. Okay, stick your tongue up and out at me. Thank you very much. And again, I want to put my fingers on the back part of the tray so I can get it seated in the posterior. Now Aaron and I just bond for a little bit. Okay, now I just reach in the back and kind of lift it up on one side, and then reach around his head and take it out. Okay, and then again you can see we have a nice outline of the tissue, and we have a good mold of all the teeth. And again, that's kind of what the lab would like to see in any appliance, or if you were taking study models, the doctor could see all the teeth in the way that they are in the arch.